Welcome. So this is a short video for Unit 10, Sociological Perspectives of the BTEC Level 3 course, and it's introducing models of healthcare. So this is kind of relating to P3, M2 and D1 of the coursework criteria. Now the first thing just to flag up is don't forget you have got these textbooks on either an electronic form or physical form. So the Health and Social Care, Pearson's textbook, the AQA Sociology textbook and the Sociology Ken Brown textbook. These are all really helpful for providing definitions and explanations, and also for use as references within your discussion. And what I've done there on the screen, you can see are the relevant page numbers for the different models and different theories. So the first thing to question is what is a model? So we talk about models of healthcare, and a model of healthcare or model of care is basically the way healthcare services are delivered. So it's either the style, the purpose, the intention, the design of healthcare. So basically it's the type or style of healthcare and how is it or what is it that's being delivered. So these definitions on the screen are just ones that I pulled from a quick search online. I've put the reference and the links in there as well. But as I say, I think they're quite good at summarising what a model of healthcare is. Particularly the second one, I think, like I say, a care model is a set of intentions, activities and tasks that are carried out consistently and targeted to a given population. So it kind of fits what we're talking about and what we're going to discuss. Now the three types of health model that we are going to talk about in our coursework for P3 are the biomedical, the social and the complementary, and each of them differ in sort of the way in which care is delivered, the style of care they want to use, and how they approach illness and disease. Now what we're going to do is we're going to talk about each model. We're going to talk about what it does, what it says. We're going to try and link it to your setting, and we're going to think about pros and cons, draw a bit of comparison. So we're going to touch on all the materials that will help cover P3, M2 and D1. So the first one is the biomedical approach. Now to a large extent, most of UK healthcare and healthcare across the world is kind of centered around the biomedical approach. So we've grown up with a care system that is restoring people's health, it's responding to illness. We put our faith in doctors, we put our faith in medicine, and increasingly people are being judged along the lines of whether they are healthy or unhealthy. So there's a clinic in the US, the Cleveland Clinic, which stopped employing smokers because they were deemed to be more likely to be ill, more likely to be absent, and also going to have prolonged illness periods because of their smoking. Now the biomedical model was pretty dominant within most societies from the 19th century, and even today it's still fairly common to find the biomedical approaches, and the approach is designed around treating an illness, and it's what we're kind of, medicine and the role of doctors. And so as that quote says at the bottom from Taylor and Field, health is seen as a war waged by doctors and nurses against the enemy of disease. So just a few more definitions really. So health is defined as the absence of illness and disease. So from the biomedical approach, you are healthy if you do not have a disease or an abnormality. It's something we'll talk about later called a negative definition. So the idea being you're healthy because you're absent from disease. Disease is generally caused by biological factors. So biomedical approach takes it that most illness is a result of genes, genetic issues, and they see poor individual decisions. So smoking, drinking, poor diet, they are the cause of illness, and it's an individual choice to engage in those activities. The human body is like a machine. It will break down. It needs medical experts to fix it, repair it, get it working again. And the health of society is dependent on medical knowledge. So there's been massive advances in medicine, medical knowledge, vaccines, and all of this has been credited with reducing ill health, and it's assumed that medicine will eventually conquer diseases like cancer and heart disease. So this approach views the role of healthcare professionals as making society healthier, and it's purely from the development of medicines. So just as an activity to get you thinking, now again you can pause the video in a second and have a think about this, and I'm going to go through the answers in a second. So try and think about how many methods you can think of how a doctor will keep you healthy. The most obvious example, just to get you started, would be like giving you medicine, giving you tablets. So have a think what you can come up with, and I'm going to obviously pause the video here, and I'm going to put the answers on the screen in 3, 2, 1. And there we have our answers. So some of the suggestions you could have come up with would have been vaccinations, operation, counselling, therapy like Alcoholics Anonymous, offering support, general advice, and tests. These would be the things that doctors do to treat an illness. Now, the biomedical approach does have its connections to functionalism. And this could be a good way of, when you're describing and explaining the biomedical, you can think about the connection it has to functionalism. Also, when you're linking it to your setting, you would have discussed how functionalism applies to your setting. You can use and reuse some of that information. So Parsons talked about how medical professionals, they control access to what is the sick role, the definition of whether you are ill. So maybe take a minute to go back to the previous section and remind yourself about the sick role, and maybe reread Parsons. But ultimately, illness is bad. You can't contribute to society if you are ill. So you adopt a sick role, and it's the idea being that you are labelled as sick. You can't contribute because of your illness, and the sort of responsibility is to get yourself better. And doctors control access to the sick role, they control access to medicine, and they control your ability to get better. Now, again, just another activity, you can take your time with this. You've got the Ken Brown textbook, which has been placed on Padlet, and on page 370, 371, it talks about the biomedical approach. It has 4 bullet points about how the biomedical approach works. And what you can do in your pack, I think there's space for this, is make a summary note of that information. There's also an extension, which is, I think it's 371 again, which talks about Foucault and the medical gaze. So have a look at those and fill them in. I'm going to put the answers on the screen in a second, just so you can see them if you want to have a look and check. So these were the answers. These are the 4 bullet points I was talking about. So disease is caused by biological factors. The human bodies are like a machine. Causes of ill health are soon to be moral failings of the individual and lifestyle choices, and science is seen as a way of solving problems. This is the view on and the main features of the biomedical approach. Now, to draw a comparison, again, one of the past criteria is to compare the model with other theories. So here we've got the biomedical approach, and I've just drawn a comparison. So when it comes to the social model, we'll look at it later, but they both recognise illness is affected by lifestyle. Biomedical model we're looking at blames the individual for their poor life choices. Social model sees people as a victim of life choices and options. And they both recognise that medical treatments do prevent and manage conditions. So there is some similarity between the biomedical and the social. The one difference being is the cause. So biomedical is all about treatment of an illness, whereas social models are more about preemptive prevention of an illness. But we are going to talk about the model in a second. And the complementary model, again, we're going to talk about it later, but just again, the comparison is that, both biomedical and complementary say that, their methods can be used in combination to deal with cancer. But biomedical is based on science, biomedical focuses on cures of an illness, and biomedical is hospital based. Complementary is often less scientific, more about pain management or managing a condition rather than curing it, and is often home centered or self-taught. You can't practice medicine at home on your own, you have to be trained. Complementary methods, you can do that. So let's look at linking the biomedical model to your settings, or how we can link them to settings generally. So the first of it is that most GP settings, most of the settings you've chosen are going to be biomedically based. They're going to generally take biomedical approaches by treating individual symptoms and providing medications for illnesses. Most doctors or most individuals go to the doctor once an illness has emerged, rather than the way of preventing an illness. The doctor controls access to the sick role and patient access to medication. Most of the websites focus on diseases and medical issues. And you can even think about the posters and the notice boards in the practices. So if you are able to go to your practice, I know that's kind of difficult at the moment with Corona, but hopefully at some point, once this has started to withdraw, you can maybe look at the posters in your practice and look at what's being advertised. They provide immunisations and vaccinations as a treatment of illnesses, and we can evaluate this in the sense that, is there preventative health being provided by GPs? So smoking cessation would be preventative measures. That's inconsistent with the biomedical approach. So these are ways we can link your setting to the models. Now, again, one of the things like that evaluation point, you can challenge. So if your setting doesn't fit a model, you can say so. So if your setting doesn't fit the complementary or the social model, you can highlight that it doesn't fit the model because. So it doesn't just have to be showing examples, you can highlight ways in which your setting doesn't fit it. So here are some strengths and weaknesses of the biomedical model. You can see there are far more weaknesses than strengths, but the strengths are that technology and research has improved. Treatment and vaccinations have become more effective, preventing the spread of more and more diseases, and life expectancy continues to grow. Ways we can question or challenge the effectiveness is that there's been a movement of anti-vax parents, and anti-vaccinations has risen quite significantly. A lot of health trials aren't published because some of the information, some of the data is hazardous to people or harmful. There are lots of medical errors that occur, and the effectiveness of medicine is often exaggerated. It doesn't take in holistic approaches, which is considering the whole person. So it's not just a physical illness, but it's mental health, social health, and interaction with others. And also, we do put a lot of trust in medical professionals, and there have been historic cases of doctors abusing the trust. So we've got the Harold Shipman murders, obviously a key indication of trust, but also there have been recent examples with doctors committing acts which, unnecessary medical procedures, or there's the one doctor who laser etched his initials into transplant patients on the organ that he transplanted. So there's a history of individual doctors that do not act in the biomedical model, and obviously we trust them. And one other criticism, just one to flag up, that does come up in PE4, but I think it's quite good to mention here, is lateral genesis, which is basically the idea that biomedical approaches focus on dealing with the issue, but they don't look at the root cause. So for example, with these images of people being thrown in the river, the doctors are pulling them out of the water, but they're not looking at why they've been thrown in the water in the first place. So but poor diet, pollution, housing is cause of illness, but they don't look at the causes, just how to stop it. Here we have on the screen just some suggested articles, again, ones that you can put into your discussion of the biomedical model. Remember, when you're putting articles in just like this, put the article in your own words. So maybe it could be summarising what the article's about, what's it got to do with the biomedical approach, but do it in your own words. Don't just copy and paste a link and try and pass it off as your own research or own discovery. So do say what it is and what's going on. And as an extra activity, this will be in your pack. It's just some examples of the biomedical approach possibly not working as effectively as it should have done. So again, these would be really good for criticisms and evaluations of the model. So I'd say do the research, go through the pack and complete these tasks in your own time. So this leads us into the social model. Now the social model is very different to the biomedical in the sense that this model highlights the factors that cause ill health and define health as a basis of also these factors and these lifestyle choices that have an impact. Very different to the biomedical, which is about treating an illness once it's arisen. Social models are slightly more preemptive. It's about trying to tackle the cause of ill health, like poor diet, poor housing, stuff like smoking, drinking, and reduce or prevent those developing into an illness. We can even see it with the current COVID-19 pandemic, a really good contemporary example you could mention. That is not that it's just your risk of dying from the virus that's significant, but obviously there's a lot of action being taken to try and prevent the spread, prevent people catching the illness. And obviously also the fact that there is a difference between social groups. Some social groups are more prone to suffering and being affected by the illness. So particularly people in poorer areas are more likely to be at risk of contracting the illness. And again, a lot of that comes from social factors. So the societal factors that influence your health. Now, again, this is an activity in the pack, something for you to think about how your lifestyle and how things in society affect your health. Now, again, we can think back to the exam unit, particularly B3, B4, B5 that we talked about last term. These are all really good examples of environmental factors that affect health, and you can use them to support the arguments in your course. So just some examples of the social model in action. Again, some references you can discuss. I think the sugar tax is a really good example of social models of health. So again, it's all about preventing the health and illness increasing. And one of the causes of poor health is poor diet, particularly sugar. And so the sugar tax is designed to try and reduce it. And you can see on the cans that the idea that pre and post tax, some companies have reduced the amount of sugar in their drinks to reduce the tax cost. Other companies have just kept it the same and put their price up. But the idea being that either more expense or lower sugar, either way, these should help improve health because people are going to be buying less of the drink or consuming less sugar. Now, the social model may question the importance of biomedical because, again, writers such as McNown look at how improving health and life expectancy was linked to sanitation and water improvements and housing condition improvements. Particularly the biomedical sort of says that improved medical treatment is making society better, but McNown is quite good at highlighting actually a lot of decline in illness and disease came from better sanitation, better clean water being provided. So the image is obviously when they started to try and tidy up the Thames and provide clean drinking water, because most people drank from the Thames and it was heavily polluted with corpses and human waste and all sorts of stuff. So it's the idea that this was a radical change in improving the health of society. Now, drawing a comparison with other models. We've mentioned before the biomedical and social model have similarities that they both look at illness being caused by lifestyle. Now, the biomedical blames the individual. Social model says that they are victims of the environment they find themselves. They both recognise that treatments and medical treatments have improved and that helps prevent conditions, but they differ on the cause of illness. Social model and complementary model have similarities in the sense that they both have a role in preventing illness and controlling it. They both see the individuals actively involved in preventing illness, and they both consider environmental factors as a part of this illness process. Now, linking to our setting, there's a lot of ways we could link the social model to our setting, even though we know they're predominantly going to be biomedical. So we can look at stuff like the idea that most practices will offer healthy eating, smoking cessation. They will encourage healthy lifestyle. We've got sexual health clinics, mental health and wellbeing services that are supported through your GP. Your GP might refer you to other agencies beyond the biomedical, so pushing you towards social services, counselling, and some of the social model approaches. There's help with charges if you're on lower income, so it does recognise that social income and class have a role to play in illness. And health checks for illnesses, disease. Some of these tests, like smear tests, mammograms, are preventative. They're trying to identify and catch illness early on before it becomes a significant issue. Strengths and weaknesses again for you here. So again, you can pause this, have a look. Generally, as always, there's going to be good strengths and some examples of studies to support them, but there's generally more weaknesses. So it's cheaper, it's preventative, and it encourages individuals to take responsibility. That's quite good. But the problem is there's quite a few. So it relies on the individual being active, and trying to trust people to do the right thing is the problem. We find this at the moment that with the corona outbreak, asking the people and the public to be responsible clearly isn't working. Bans on sugar and fast food, encouraging family support networks, encouraging changes in individual lifestyle. These are the things that will help, or are meant to help, but obviously their effectiveness is limited in some capacity. And last but not least, we have the complementary medicine. And complementary model. And I'm going to go through this very quickly because there isn't as much here. So this is about bringing in techniques like acupuncture, aromatherapy, reflexology. They're not usually prescribed. They're often linked to traditional medicine. They are often used alongside medical treatment. And I suppose the membership and the people using them is self-selecting. You will choose to go to have Reiki or acupuncture or aromatherapy. The medicines and the treatments are what we call holistic, because it's about trying to treat the whole person. So it's physical, it's spiritual, it's social, emotional. Complementary medicines challenge the biomedical. Biomedical is about giving you the pill that will fix it. This is about trying to fix the whole body. And the social, and it's kind of quite ancient techniques, and a lot of them have been questioned in terms of their effectiveness compared to medicine. So one of the things you can think about is, can you think of examples of complementary medicine like aromatherapy, reflexology, acupuncture, and who would be likely to use them? So think, so these practices, they're not cheap, they're quite expensive. So again, people who use them might be more likely to be middle class. Generally, the clientele is more likely to be women than men. And as that second question there, does your practice offer them, or have you got to go elsewhere to have them done? Now, making connections between your practice and the complementary model. Ultimately, there's not going to be a massive connection. Your GP is biomedical, it's not going to offer complementary techniques. But that's something to highlight, that your setting does not really promote the complementary medicine. It focuses on biomedical. You could obviously look at notice boards, as we said before, see are there any examples of complementary medicine being advertised in your practice, or maybe does your GP refer people onto these techniques? But that might be something to look at from the website or speaking to people who have attended your practice. Postman on this, come back to theory, very pro complementary medicine, because again it's about the choice, the diversity and the flexibility of healthcare. Comparing it to other models, again, the biomedical and complementary can be used together. So pain management for cancer is often quite a common thing. It's based on scientific evidence, but the complementary model really isn't. So biomedical and complementary. So there are some similarities and differences. Social model, again, we've highlighted this, the fact that they both play a role in preventing illness. They're both active for the individual, and they both consider the environment. So as I said, linking back to your setting is going to be slightly challenging because it's less likely to be used. But look at the notice boards and think about, and maybe even think about what complementary medicine is offered in your local area. Because again, you might find, even though your GP doesn't recommend it or use it or highlight it, if you've got in the same area 10 Reiki practitioners and some aromatherapy clinics and some acupuncturists all in a very small area, it might show that the local demand for them is quite high. And that could suggest, in a sort of roundabout way, that complementary models are being used in your area, possibly alongside conventional medicine. So strengths and weaknesses again for you here. Just you can pause this, take a look. I think some of the strengths is that a lot of the supplements that are being promoted are actually quite good for you. So for example, health supplements like women taking folic acid and vitamin D for babies, that's recommended. That's kind of fits under this model. I also thought it was quite interesting the conflict information, particularly the sort of the idea about urinary tract infections and cranberry juice being quite good for them. So the two links is one from the NHS saying it does suggest cranberry juice to help with UTIs, and then another NHS bit of information saying cranberry juice doesn't work. So I guess the idea being that there is this conflict within the biomedical, so it does have some link, but doesn't. And again, the weakness is quite a few there. You can take your time to look through them. But ultimately, it's the idea, I guess, is the stuff like the costs, the time, the effectiveness of them can all be questioned. Okay, and just to wrap up, so just to recap where we are. So the biomedical model, as we said, it treats the individuals with medicine or treating an illness or an injury directly. The social model is way of dealing with health, but it's preventative. It's trying to prevent illness developing by tackling the causes, whether that's poor health, poor diet, lifestyle, or living arrangement. So it's more about preventative, and it also highlights that there is a difference between the victims of illness. So certain groups are more prone to illness, whereas the biomedical model blames the individual for illness. And holistic approaches, sorry, complementary approaches at the end, you know, crystal healing, yoga, meditation, these complementary methods about dealing with the whole individual. And that mentioned, as I said, holistic approach, tackling the whole person and their well-being. So that's the 3 models summed up. So I hope this is helpful. I will at some point get around to doing a writing P3, so some advice and some hints on how to approach the writing of the P3 section. As always, go through the pack, go through the PowerPoint, go through the Padlet, and if you're still unsure about anything, just pop me, Joe, John, Andrew, whoever is your teacher, just drop us an email. And thanks for watching.